Hello, my name is Usmani. This is the N495 Health Assessment course at Aspen University, and this is the Module 6 assignment of the head-to-toe assessment. I have here with me Dylan. So Dylan, do you give permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University Class N495?
Yes.
This assessment is intended to show my skills with the assessment actions only and is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
And how old are you?
23.
Alright, so we're going to start out by taking his vital signs. We're going to get his blood pressure. His oxygen saturation and his temperature. Temperature of 98 degrees Fahrenheit is within normal limits. Take his radial pulse. Which matches what we show on the monitor at 57 beats per minute with a saturation of 100%. On room air with a blood pressure of 145/87. And we're going to count his respirations. To be approximately 16 breaths per minute. Are you in any pain at the moment?
No.
Okay, so I'm going to perform hand hygiene. Now, can you tell me your name and date of birth, please?
My name is Dylan Barr, date of birth 9/12/86.
Okay. So we're going to start with the head, face, and neck. We're going to inspect the structures of the head, face, and neck. I'm going to palpate the carotid arteries on each side and the temporal arteries. Does this hurt when I press?
No.
We're going to palpate the thyroids on each side of the trachea, looking for swelling. There's no swelling noted. And we're going to palpate the trachea, noting that it is midline, there's no deviation. Next, we're going to assess for sensation in the trigeminal nerve. Close your eyes for me. Tell me which side you feel this on.
Left. Right. Right. Left. Top.
Okay, so now we're going to assess for facial symmetry. So I'm going to ask you to raise your eyebrows up real tight. Now close your eyes really tight. Now smile for me and frown for me. Now notice that both sides of the face are completely symmetrical. And now we're going to assess for the 12th cranial, the hypoglossal nerve, and ask you to say light, tight, dynamite.
Light, tight, dynamite.
And now we're going to palpate the cervical lymphatics, Checking for any swelling. There's no swelling noted. Any discomfort?
No.
And now for the skin color, moisture, and temperature. His skin appears to be of normal color. Normal moisture does not appear to be dry or diaphoretic in any manner, and temperature to touch is normal. Assessing his skin turgor, pinch the skin for elasticity, release and notice that it returns completely to normal. His capillary refill time is less than 10 seconds. Less than 2 seconds on each hand. So looking at the lower extremities for edema, we note that there is no edema built up. So his eyes, Alright, let's go around this way. Alright, so do me a favor, turn over here and then sit up like me. Sit there. So we're going to look at the tip of my pen. Okay, so his ocular motor nerves, so the 6 cardinal fields of gaze are intact and there's no complication noted there. Now we're going to test for confrontation. Cover one eye for me. How many fingers am I holding up?
1.
How many fingers?
2. 1. 2.
Other eye?
2. 1. 2. 1.
Now we're going to use a light source to inspect the eyes. First looking at corneal light reflex or twinkle. Noting that corneal light reflex is normal, and now we're going to assess the pupils. Pupils are equal, round, reactive to light with normal accommodation. Now we're going to look at the ears. Noting that the ears are of normal color, no redness noted, no drainage, no pus, no other signs of infection noted in the ears. Okay, so now on to the nose, mouth, and throat. We're going to palpate the maxillary and frontal structures. Does this feel tender? Is there any pain?
No.
Okay, now we're going to inspect the internal nasal passages. Noting that there is no signs of bleeding and all membranes look intact. And we're now going to look into the oral cavity, into his mouth. Good, open your mouth for me and stick out your tongue. And go ahead and say ah.
Ah.
Thank you. Now we're going to assess his breathing for proper effort, approximate rate, and quality. His breathing is noted to be non-labored. approximately 16 breaths per minute. Now we're going to palpate the posterior chest for tenderness and masses. Does any of this hurt?
No.
Does any of this hurt?
No.
We're going to palpate for tactile fremitus, say 99.
99.
It's normal. We're going to percuss for potential consolidation. And we're going to auscultate. Let's see. First, we're going to percuss for CVA tenderness. Does this hurt?
No.
We're going to auscultate breath sounds. Take deep breaths for me. We're going to auscultate the carotids for bruits. There does not sound to be any type of occlusion there. And so now breath sounds in the anterior chest. And now to listen to heart sounds, the aortic, pulmonic, tricuspid, and mitral valve. Okay, so if you could lay back on the bed, please. We're going to inspect the abdomen, noting that there is no bulges and no pulsations. We're going to palpate each of the 4 quadrants. Does this hurt?
No.
Any tenderness or pain? And we're going to listen for bowel sounds. We do hear positive bowel sounds. Okay, so for the extremities, we're going to inspect and palpate his joints, wrists, elbows, shoulders, and knees. Can you feel me touching you here?
Mm-hmm.
I'm touching you there. We're going to take a look at his knees. We notice no deformity. You feel me touching there?
Mm-hmm.
Left knee as well. You feel me touching there?
Mm-hmm.
Okay, so assessing range of motion, can you move your arms? Any complication there?
No.
Can you raise your legs? Can you move your ankles? Push against my hands. Pull back. Same thing with push against me. Pull back. No difficulty with movement or range of motion. Okay, both radial pulses. Both pulses are present and strong and regular. Posterior tibial pulses. Posterior tibial pulses are strong and regular. Alright, so for a neurological exam, if you could stand up, please. And from here to 5 feet ahead, walk one toe, heel to toe. And just a few feet up and back. This barefoot gait appears to be normal. So for the Romberg test, we ask you to just go ahead and stand, your feet about shoulder width apart, and stand straight. And we're assessing for swaying and noting that there is no swaying present. And for a cerebellar test, if you could please sit down. Take your hands and alternate them quickly. And we note that this is normal. So in conclusion, Mr. Dylan here appears to be in excellent health. Thank you, my name is Ross Usmani, and this has been the head-to-toe assessment for N495 Health Assessment at Aspen University.